Welcome to Good Grief, the podcast where resilience meets reality. I'm your host, Dr. Christine Malone. In this podcast, we delve deep into the stories of individuals who've triumphed over tragedy, adversity, and trauma. In every episode, we bring you raw and honest narratives from guests who faced life's most challenging moments head on. Through candid conversations, they share their journeys of resilience, shedding light on the strategies, mindset shifts, and support systems that empowered them to rise above their darkest hours. Join us as we explore the profound depths of human resilience and discover how, even in the face of life's toughest trials, there can be light, growth, and yes, good grief. Okay, listeners, thank you so much for joining me for this episode. My guest today is Olivia Abousaid, and we are going to talk about the topic of grief related to chronic illness. So, Olivia, if you'd like to tell us a little bit about yourself and kind of what it's like to live with a chronic illness, the grief over that, things that are different in your life based on that illness, and we'll go from there.
Sure. Well, thank you, first of all, for having me on again. It's my second appearance on the show, and I always love meeting people, working with people who are working in the grief space. It's a weird thing to be passionate about, but
I agree.
but it's such a necessary one, and so many people are dealing with grief and trauma that it's such, it's great to meet other people working in the space because they tend to be very empathetic souls.
True. And I often tell people, we will all go through some type of grieving episode, whether it's someone you lose or an ability that you've lost or a relationship. We will all be there if we haven't already. So learning to talk about it more freely, and because it's normal and natural, I just think bring it more to the norm in our culture, to say it's not, we don't need to just shy away or, whatever. We can actually talk about it, but it's because it's who we are.
Exactly. It doesn't have to be a taboo subject at all. Let's break down all the taboos.
Yes, exactly. And it is a kind of an odd thing to be passionate about. And I know I've probably shared with you when we met last time, this is actually my hobby. I do this just for the love of doing it. It's just one of my things that I fit in around all my other 8 million things I'm doing in my life because I enjoy it so much.
It is. Yeah, it is enjoyable. I love the coaching work that I do. So just to let you know a little bit about me, I'm a master certified professional coach. My background is actually totally different. I started out in the film industry, and until fairly recently, I was working in the film industry, and then really started to think about what can I do where I can serve people and help people? Because I was working in sales, and in a sense, you are helping people in sales where you're helping them find the right equipment, etc. But I really wanted to get a little deeper than that and help people improve their lives and transform their lives. And so when I first started thinking of coaching, it was transformational coaching. And then I realized that the reason so many people need transformation is because they've experienced a lot of trauma and a lot of grief. And there are a lot of people that are sort of stuck in that space where for either months or for years, where they don't know how to sort of extract themselves from that. They desperately want to, they're ready for a change. But when you're in that for months or for years, it becomes comfortable. It becomes a comfortable space, even though it's not a happy space. It's not a space you want to be in. Right. But now it is comfortable. And so people can want to move on, but don't quite know how, because change can be scary and it can be uncomfortable.
Yes.
So that's what I do with my coaching.
Yeah, it's fearful. And I completely relate to that, because I've had many people I've talked to where it's like, there's things that people you could talk for, things you could do differently. And I'm like, yeah, but I know what it's like to be where I am right now today. And I don't know what it's like to be over there. And so I'm afraid of what might be over there. So I totally get what you're saying.
Exactly. People want it. They just don't know how to get there. And so that's what I try to help them with my coaching. And then 3.5 years ago, I was diagnosed with an autoimmune disease called lupus. Okay. And for those who don't know what lupus is, it is this autoimmune disease where your immune system attacks your body and your tissues because it doesn't like a sort of a normally functioning body. It doesn't recognize viruses and bacteria and things like that as the enemy. Instead, it thinks your own body, your own tissues are the enemy. So oftentimes we have to take immunosuppressants or immunomodulators to kind of change how our body works so it's not always attacking itself.
Right.
And some people even have organ involvement where it has affected their lungs or their kidneys or their heart or their liver. So it can be a scary disease to have.
Yeah.
And like a lot of autoimmune diseases, there can be a grief with getting that diagnosis. There can also be relief with the diagnosis, finally knowing what you're working with.
Right,
But there
right.
can also be a lot of grief in your limitations.
Now, I'm going to guess, knowing what I know about the immune system, that an immunosuppressant probably opens you up to coming down with other things like a cold, or if you're exposed to COVID or something that your body may have been able to fight off, but with the immunosuppressant, it doesn't do as well. Is that kind of how that works as well?
It is, yeah, very much so. Even before I got the diagnosis, I knew my body was different, that I get sick at the drop of a hat. And when I get sick a lot longer and worse than most people. Even a little cold for me will last 2 to 3 weeks and it'll be pretty bad, which doesn't always work in the workplace where you have a limited amount of sick days. That
Sure.
means you probably have to go in sick or take extra measures to make sure you don't get sick. For instance, with COVID, a lot of people have stopped masking since that first year or two. A lot of people with lupus or other autoimmune diseases where they're immunocompromised are still masking. And that creates another kind of grief for those people in that they may feel disenfranchised or sort of isolated and that nobody else is watching out for us except for us.
Right,
So
right.
there's a lot going on. It's multifaceted, it's multi-layered.
Yeah. I'm also thinking, it's kind of we'll call it a disability, if you will, to use that
Mhm.
word, but hidden, right? So if I'm
It
working with
is.
someone who has this, I don't know, I can't see it. You don't have it written on your body. So it's just, but then you're masking and I'm thinking, well, she's being like way over the top, we're all living with this now, whatever, rather than knowing that this is
Mhm.
something that you need to do for you. So, I think any of those hidden things that maybe the people around you don't know about are probably even more difficult, not only because you become, kind of, I don't want to use the word, but ostracized or sort of, why are they doing things this way, or why is she sick so often, so on. Whereas, there's a reason for it, but do I really need to tell you about my whole, do I need to tell my
Mhm.
coworkers and I don't, that kind of conversation.
Exactly. And it affects people in different ways. Um, you know, people can feel isolated because of their limitations. They can feel isolated about how people view them. Some people most people with autoimmune diseases look quite normal. It is a hidden disease. And so people will expect you to perform at a certain level to be able to do the same amount of work as other people or to exercise at the same level as other people. And so, you're bearing the weight of certain expectations.
Yeah.
And there's a grief also in that you're always having to educate people and say, well, I can't do that, in fact. Or some people aren't as open about wanting to share with other people that they have these diseases for
Right.
one reason or another.
Mhm.
That's their business. But, that can be another layer of grief for them and that, they don't feel normal on the inside.
Right, right.
And all those doctor visits are another indicator that they're not normal. All the medication is another indicator that they're not normal. And each of these things adds another layer of grief and sometimes isolation as well.
And this is a lifelong illness. It's not something that, you're going to get over with time or anything like that.
Lupus is, yeah, it is lifelong. There's no cure for it. There's just management, symptom
Management.
management.
Yeah, yeah, that makes sense. So, and you mentioned something that I think is really important to touch on, and that is the sense of relief in at least getting the diagnosis.
Mm,
So, I know a lot of people who've dealt with whatever symptoms they're having, and the frustration, especially if the medical system is not finding out answers for them very quickly. That when they do finally find out this is what it is, it's not just in my head, it's not this whatever, but I've got this diagnosis now, and I can now stop wondering and stop stressing about it, but at least focus on what this is and what I can do about it.
mm. Yeah, that's very true. For instance, I think I read some statistics somewhere that it takes about 7 years or so to get a lupus diagnosis.
Okay.
And I know for other autoimmune diseases, it can take several years to get a proper diagnosis. And that's because some of the symptoms mimic symptoms from other things as well.
Right, right,
With lupus, a lot of the symptoms, not a lot, but there are a good amount of symptoms that are similar to perimenopause. There's the brain fog and the fatigue and things like that. And women tend to get diagnosed with lupus in middle age. So it can be really confusing to try to get that diagnosis properly. And when you've got lupus and perimenopause, then that can be, your symptoms can feel magnified and you don't always know, well, which one of these is affecting me right now.
right.
So there's that, but it can take a few years to get the diagnosis. In the meantime, you don't know what's wrong with you. For instance, with me, I had major fatigue and I still have major fatigue. That's something that the medicines don't seem to help with that much. And I was going to doctor after doctor. Why am I so exhausted all the time? What is this fatigue? And none of them had answers for me. And it was finally my skin. I started to get these plaques on my face. And I still have a couple that mimicked eczema. They looked like just eczema plaques. And so I was getting misdiagnosed for a while from dermatologists until one of them finally said, let's do a biopsy. And it came out positive for lupus.
Okay.
And then that's when I was referred to a rheumatologist who then did the blood work. And then I finally got that diagnosis. And so there was a relief in that after all these years of questioning and all of these health issues. Now I finally have answers. I finally have a name for this.
Yeah.
I know what these symptoms are about. And now I can finally start to learn about it and learn what to do for myself and to
Right.
advocate for myself. But it
Yeah.
took a while.
I'm curious about one that I've obviously heard of lupus. I actually had a coworker who had lupus, so I don't need to think it's terribly rare. So I'm curious in the healthcare system. I know you're saying that some of the symptoms can mimic other things. Why providers don't think to look for that if they have a patient who's having some of these, even if they're mimicking other illnesses, and say, oh, I'm putting this together. She's got the fatigue and now she's got the plaque or whatever, and think I should test for that. Because if it's as easy as a blood test, which it sounds like it is, why we wouldn't be thinking more along those lines and so on.
It's a good question.
Yeah.
Yeah, it's a round of blood tests with lupus. You have to have something like a few markers and a few different blood tests that will tell you if you're positive for lupus. So it's not just one, but also because it mimics so many other things. But fatigue is such a big one that there should have been other
Yeah.
blood tests happening. At least there's one major one that says, yes, this person has some sort of autoimmune disease.
Mhm.
And that one is not, I think that should be more of a frontline kind of thing that happens. And
Right.
then also something we've learned over the past few years, I think, is that healthcare providers don't take women as seriously when they talk about their symptoms.
That'd be my next
And it
my
can
next question.
take,
Yeah.
yeah, it can take longer for women to get a proper diagnosis. And what's a staggering statistic about lupus specifically is that 90% of people who have lupus are women.
Okay. Yeah, I did not know that.
And so it takes longer to get that diagnosis. And then, there is some thought around estrogen maybe having some sort of interplay with that because so many of the people with lupus are women. They're not quite sure yet. And then also there's some thinking around sort of how our stress affects
Hmm.
our physical health because women do tend to internalize stress more. We hang on to stress a lot more. We don't always have good outlets for stress. We women definitely hold on to stress a lot more and grief and
Yeah.
trauma that lives in our bodies a lot and that can make us sick.
Yes. Yes.
And so there's a lot more learning that's happening about that the past few years. And that's where I'm trying to help with my coaching, is that, stress and trauma and grief can affect your emotional resilience.
Oh, yeah.
And then that can affect your physical health. So
Yes.
we want to stop that process. We want to stop getting sick. Or if we are sick already, we want to stop it from getting worse.
Right, right. I mean, you brought up a good point. You used the term you had to advocate for yourself, which I know a lot of people, well, especially people in an older generation, would not feel comfortable, questioning their doctors or making a suggestion and saying, "Hey,
Mm.
I read an article about this thing, and I'm wondering, can I be tested for that? Is it a possibility that that's something that I might have?" They may not feel comfortable, right? I mean, a lot of people don't feel comfortable, not necessarily questioning, but suggesting things to their physician because that person's supposed to be the expert on all these things. And who am I? I just read this thing on the internet, right? Sort of a question.
Right.
So if you had, someone listening who's got some kind of a thing going on with themselves, and they're not real sure what it is, and no one seems to be able to diagnose them yet, how would you suggest that self advocacy for someone who might be feeling uncomfortable talking to their doctor, questioning things,
Mhm.
saying, "Hey, have you thought about this?"
Well, something I emphasize, and not just with doctors, but just in general to my clients, is learning to assert yourself.
Yes.
And I had a client one time who said, I'm not good at being confrontational. So there can be this thinking that asserting yourself or speaking up for yourself is being confrontational. And a lot of us were brought up to be nice all the time. You don't question authority, you're nice. And that really can work against us both in healthcare and in life in general.
Yes.
And so doing your research, a lot of the time, unfortunately, we do have to be our own advocates. We do know our bodies best. And we do have to do a little research on our own, because a lot of doctors, they may have 5 minutes to spend with you and then they're on to the next patient.
Yes.
And with a lot of these autoimmune diseases as well, unless the doctor is a specialist in that area,
Mhm.
your general practitioner may not have studied your autoimmune disease that much.
Right. Right.
And so do your research, speak up for yourself, and asserting yourself doesn't have to be confrontational. It doesn't mean you're not nice, but you do need to advocate for yourself and speak up for yourself. And so we do practice that. Um,
Yeah.
yeah, we do practice assertiveness in my
Yeah.
program.
I'm going to speak to the people who are actually in the field of healthcare, who work in healthcare. So I did healthcare leadership for a number of years, and I certainly had providers as well as nurses, medical assistants, and so on that would think, oh, this patient's just, they're a hypochondriac. They're coming in all the time. They've always got something going on, and they sort of become dismissive. And to me, it's kind of like, I get that. You got 5 minutes with that patient. I get that. But when you've got someone who's coming back and having different symptoms and so on, how would you advise, if you will, or give some sort of thought process to those people who work in healthcare for those patients who are coming in that maybe have something chronic going on, to be a little more open-minded, empathetic, caring,
Mhm.
rather than just push them off and just say, hey, this person's just, I remember one doc used to call them frequent flyers. This patients would come in commonly for things
Wow.
as frequent flyers. And I think that is just the most insensitive thing to say
Insensitive.
about
Yeah.
a patient. And hopefully they didn't hear you say that, kind of a thing.
Wow. Yeah. That was the first word that came to mind, was insensitive.
Yes. Yeah. So kind
I
of the,
get that a job is a job, and that, we've all worked jobs where there are certain customers or clients who can feel a little bothersome. But when it comes to healthcare, dismissing that person can be, if not deadly, it can be, can really affect their health very negatively for years at a time. So it is important to take it seriously.
yes. And I think maybe maybe you probably had this with your clients, is maybe sometimes you need to find a different doctor, right? If I've got a doctor
Yes.
who's being very dismissive and not listening to me or telling me, it's all in your head. An example, I have a good friend who has fibromyalgia, and she spent years and years and years with the same doctor who just dismissed her and, kept telling her, well, it's in your head. It's not something, there's nothing wrong with you. And finally she switched to a different
Mhm.
doctor who was able to properly diagnose her, but she spent way too much time being,
Right.
and that I remember thinking is not, again, woman my age, and she just didn't want to question. So, well, he knows best, and
Mhm.
clearly he did not. And that's, the I think sometimes it's like for a lot of our docs who maybe aren't skilled in knowing some of these different diseases, is to have the thought process to refer someone out and say, let's refer you to, a specialist in whatever, and have that person test and see if you have something else going on that maybe I'm
Mhm.
not familiar with. And that's, to me, I think that's a positive thing for providers to be able to do that and say,
Right.
this might be above me. This might be beyond me. This might be something
Mhm.
I've not seen. And rather than just continue to give this person antidepressants or whatever, because I think it's in their head, we can
Right.
help in other ways. So that's kind of my thought with, especially like I said, working in healthcare for as long as I did. And working in education now, I try to school my students, don't ever do this, don't do that. Just, listen to the person and see what you can do to help.
That's great. I think you brought about a really good point just now when you mentioned antidepressants.
Yes. Yeah.
Because sometimes, people, there are doctors rather who will say, well, it sounds like depression, and they'll send you along your way with an antidepressant. The tricky thing about autoimmune disease or, many illnesses is that the depression can be a result of
Yes.
what's going on with your body.
Mm.
And so there does need to be a deeper dive and a deeper look. But I've been guilty of it as well. I've stayed with doctors way too long because I thought, well, they're the experts, they would know. And these days, I'm much more likely to switch doctors if I feel like I'm not being served well. And I am much more likely to speak up. I had to ask my doctor recently, like, please mask up. Please have your staff mask up around me. I am very immunocompromised.
Right.
I do feel like I shouldn't necessarily have to ask for that in a healthcare space, but I did, and I felt good about it. And we do have to sometimes assert ourselves in
Yes.
certain ways.
And I think on the side of the healthcare facility and the providers, it really does show that you care about that person. And I'll give you a personal example. So I had breast cancer several years ago, and I still go in to see my oncologist for an infusion to offset what my medication does to, as we were talking about before I started recording. And they made a policy in that oncology department, even after all the other clinics stopped mandating masks for COVID, that when you come into the oncology department, no matter what you're there for, you must be masked. And to me, I thought that is showing such a sign of care and respect for those patients. We know those who are undergoing chemotherapy, for example, are probably immunocompromised, and we are
Right.
respecting them and their ability to be in this space safely, for their care by making everyone masked. Whether you are a patient, a
Mhm.
delivery person, the receptionist, it doesn't matter. You will have a mask on if you are in this space.
That's
So
great.
yeah, so I'm thinking if I know, if I'm working healthcare and I know my patient that's coming in is immunocompromised, part of my thought process in caring for that patient would be, I'm going to make sure I'm masked up when I'm in that room, and I'm going to make sure my nurse is, and so on, so that we aren't having to be asked by our patients,
Mhm.
right? I mean, yes, I'm glad we can advocate for ourselves, but I also want to put it on the healthcare workers to say, when you know this thing, and you and your brain know that a mask would be best for that patient. Why aren't you just putting on the mask and then coming in?
Mhm.
You aren't going to offend me if you come in the room with a mask, even if I don't think
Right.
you. Right. I mean, today, especially since COVID, you get a mask on, I don't even question it. It's like, okay, person's whatever. That's whatever. It,
Right.
but that's kind of my thought process when it comes to someone who might be listening who works in the field of healthcare, is to just be sensitive to what your patient needs. Not are they sick
Mhm.
today, but what can I do to make sure that I don't, cause them to become ill. Even if I don't feel sick, I might have a germ of some kind going on that I'm not sick with. I had COVID. I had COVID twice. The second time I had no symptoms. I only tested myself because I knew I'd been exposed. So I could have been out there
Wow.
exposing other people because I did have COVID,
Mhm.
but with no symptoms, I wouldn't have known. So if you come in as my patient and I, expose you, that's and to me, especially if I'm around someone who I know is immunocompromised or maybe are very elderly, I was very cognizant of, I don't want to be responsible for that person becoming ill or even dying
Mhm.
because of a disease that or an illness that I have exposed them to.
Right. And it can put that person in an uncomfortable position if they have to ask for someone to mask.
Yes. And a lot of people, and I don't want to just focus on women, but a lot of people don't feel confident to do that, right? They might come in with
Mhm.
their own mask on, but they're like, I'm not going to ask, It's like hand sanitizer or washing their hands. If
Uh-huh.
If I go into the doctor and I don't see them wash their hands or hand sanitize when they come in the room, I'll ask them to. And I know a lot of people don't have that they might, and then they might say to me, well, I did it outside the room. And I say, well, I would just feel better if you did it inside the room too. And I don't think I'm asking for too much. I think I'm just saying, can you make
Right,
sure, show me that you're treating me in a safe manner. Right. So
right.
it's kind of one of those, again, I don't want to be confrontational, but I do want to advocate for myself. And so
Mhm.
if I'm, feeling like I need this, I think asking for it is completely okay. Have you ever had anybody tell you no?
I don't think so. I don't think I have.
Or
Not in a healthcare setting,
yeah,
no.
or respond in a negative way and say, "Oh, you're being,
Right.
I'm fine. I'm not sick, even though I'm got COVID and have no symptoms." Right? It's like,
It's
they
because they
know.
kind of know that they should be anyway.
Right.
So, no, I haven't had anyone in a healthcare setting
Oh, that's good.
do that. But yeah, that's something I go over with clients is differentiating between assertiveness and confrontation, and that it's okay to advocate for yourself, and that you also can't be responsible for other people's reactions. If they do
Absolutely.
act negatively, that's on them and it has nothing to do with you. You haven't said something to offend them, and
Right.
you are not a bad person in any way for advocating for yourself.
Right. Right.
So,
And I have not, and I have asked people to mask, especially when I was ill with going through my cancer treatment. I would ask them to mask, and I never had anybody tell me no. And if I bring up about the hand sanitizer, I've never had anybody say, "Oh, I've already," I think people say, "Oh, I did that outside, but let me go ahead and do it again and here again or whatever," and
mhm,
wash your hands in the sink. So I've not had a negative reaction with that either. I do know I've had friends, students, people tell me about going into a healthcare setting where they see something that doesn't seem to be safe, like, maybe no gloves or something, and they're thinking, well, I don't want to say anything because that's the doctor or the nurse, and they know, where I'm thinking, but you are the one who's going to get sick if they don't,
mhm,
if this thing happens, or could get sick. So speak up. It's not a taboo thing to do. So
right.
yeah, I mean, yes, the healthcare workers should know better, but if they're just not quite doing it right today, it's okay to say, would you mind doing that? Or if it's not too much trouble, could I just see you wash your hands in the room so that I know that it's been done? You know,
Exactly.
it's going to make
It,
me feel better.
exactly. It can feel uncomfortable initially when you start practicing assertiveness, but that's just what it is. Like it's a practice. And
Yes.
as you do it more, you'll get better at it.
Right, right. And I love that you practice that. I'm thinking, a person maybe could even just practice, with their family member or something
Mhm.
too. Say, I heard about this. I saw this on a podcast and I kind of want to practice that. Can you be my other side and let me say this? And again, you may use the word comfortable. I become comfortable then in saying those things
Mhm.
without feeling like I'm being confrontational, right? It's not,
Exactly. And
yeah,
it's funny how these things can help with our grief process when we learn to advocate for ourselves and when we practice healthy boundaries, because it's grief and trauma, they don't exist alone in a vacuum.
right,
There are always other things at work, and it's interesting how some small changes and big changes can really affect our grief process and how we move through that. And people who have been stuck in it for a while, they've gotten to a place where they feel kind of powerless,
right.
and it's giving them that sort of that empowerment back and telling them you're not powerless, you have agency, and there are things that you can do to
Yeah.
speak up for yourself, and it feels so good when you do.
I know.
It really does.
I was going to use the word empowerment before you mentioned that. I was thinking it really is empowering to not only for a person to learn to speak up for themselves, but also to just how that feels inside. It's like, oh my gosh,
Mhm,
nobody was upset, nobody was offended, and I spoke up for myself, and I should speak up for myself. I owe it to myself to speak up for myself. So it's completely okay to do so. I'm thinking even on like the workplace, if I've worked with someone who maybe is, immunocompromised in some way, how they may say something to me without, I don't want people to have to disclose their diagnosis. It's not in everybody's interest, but to say, I really would prefer that, we do this or we do that, or someone becomes insensitive and says, gosh, you call out sick a lot,
mhm,
those types of things, to just say, you know what, think about that for a second. And maybe there's an underlying reason why that person
mhm.
is sick more often than you yourself would be, or something like down those lines. So be a little more aware, I guess, the
Mhm.
situational awareness, and rather than just assume everybody's like you, right? Well, none of us get sick, so why should I feel bad that this person's calling out sick?
And I've heard that a lot in the workplace where people get kind of called out and people talk behind people's backs about that person who's calling in sick a lot.
Yeah.
And it's like you don't know their circumstances. Maybe there's a good reason they call out sick a lot. Maybe they're sick.
That's Well, I mean, yeah, I remember when COVID was first starting to make its ugly head. Well, the office I worked in at the time, some people would come in with masks on even before there was any mask mandates, and there would be other people that say, can you believe so and so? They're just being paranoid or something." And I would always say, well, there could be some other reason. Maybe they just, they're more susceptible to a respiratory, and they don't know. We didn't at that point in time, obviously, early on in the pandemic, have any idea how bad it could be, or
Mhm.
how sick people could be, or who we needed to protect the most, which hopefully by the time we get another pandemic, we'll have learned lessons from COVID with regard to how to protect those people who need the protection the most.
Mhm.
That's,
Exactly.
that's what
And the
kind of,
workplace is sort of a minefield. It's kind of fraught with some of these microaggressions and things like that.
yeah,
Um, And outside the workplace too, sometimes people will say things to people with autoimmune disease like, have you tried yoga? Or have you tried thinking positively? Or, you know, maybe if you ate healthier or omitted certain foods. And the thing about a lot of these autoimmune diseases is they're genetic and
right,
you're stuck with them and there's no cure for them. And sure, there are things you can do to help yourself out. Get a little more movement, exercise a little more, eating healthy certainly does help, but people will sometimes give unsolicited advice, I would say, thinking that, well, if you just did this thing, then you wouldn't have this.
right, right,
And so, just to give my own unsolicited advice now to people who do things like that, like you should just think positively. I know they're probably coming from a good place and probably well intended, but it doesn't hurt to, instead of giving this unsolicited advice, ask a person what they're going through or ask that person, how can I support you through this?
right. It's like the topic of grief in and of itself, right?
Mhm.
To just tell me, well, you should be, why don't you try meditation, or have you thought about, going to this church group? I'm thinking you don't know anything about me or what works for me or not works for me, right? I mean, not this even
Right.
when it comes to stress, not everybody is helped in the same way with stress. Some people might say
Mhm.
exercise, other people might say I'm stressed over thinking about the exercise, right? Or whatever it might be. So it's like, don't assume there's a one size that's going to fix people when you
Uh-huh.
when you have no idea, right? I mean, you might say, "Oh, my neighbor had this, and this is what they tried," but not, you have you tried this or have you tried that? It might be something completely off base, and again, it can come across as insensitive.
It comes across as insensitive and it tells that person, well, you are making these generalizations about me without taking the time to actually get to know me or to get to know this disease I'm dealing with. It, it's kind of unrealistic to expect everybody around you in your world to become an expert in whatever
Right, right.
your disease is. But there are also things to stay away from, like some of these toxic positivity sayings that people give off. It's best to just ask the person, well, what can I do? What do I need to learn? How can I support you?
That was what I was
Like
going
you
to.
said, same with grief.
That's what I
Um,
was going to ask you next. Is what would you say? If I'm working with someone and they tell me they have an autoimmune disease, whatever, rather than tell you, well, why don't you try yoga or meditation? Should I just come right out and say, oh, Olivia, what can I do to make sure that I'm interacting with you in a way that's going to work for you? What can I do? And you might tell me mask or just make sure you wash your hand. I don't know.
Great. Yeah. I mean, that sounds perfect, what you just said. Just the bar is pretty low, to be honest, because a lot of people with autoimmune disease have had so many insensitive things said to them, or a lot of these toxic positivity things, like just think positively and you'll be fine,
Yes.
said to them from the best intentioned people. But a great thing to do is just, like you just said, what can I do? Do you have any resources so I can learn about this some more?
Right. Yep.
Or just say, my mom the other day was saying that she was Googling some things about lupus. And that meant a lot to me that she was taking the time on her own to try to learn more about lupus.
Right, right. Not just
so that she knew.
Yeah, so that she knew not just what she should or shouldn't do, but what you're going through, right?
Exactly.
Like, I don't know what you're going through. I don't want to ask you, well, what do you what blah blah blah, but to ask what can I do, I think is a different approach, right?
Right.
I'm not asking you. I'm saying what would you recommend I do? How can I do something differently that might be more helpful? Well, if I mean food allergies, for example, I've worked with people with food allergies. It's like, okay, what do I want to not bring into the office then that you might have an allergy to? I had dinner the other night with a lady, and the lady next to me said that she has a very severe nut allergy. And I'm thinking to myself, well, that's really good to know. I'm sitting right next to you. I want to make sure I don't order anything with nuts on it, right? Even though I don't have that allergy, but I'm thinking I don't want to be responsible for you, right? But I was grateful she shared that with me, so I didn't know that about her, and to just make sure we're all doing what was safe for her, rather than have you tried meditation to get over your nut allergy?
Right.
Like, or I'm going to eat them over here, so they're not on your. It's like I don't know, how bad the reaction would be based on where at the table we are. So I'm just going to err on the side of caution. And I mean, what I ordered didn't have nuts, wouldn't have. But anyway, it was just one of those conversations where I thought, immediately in my brain, I'm going to, well, what do you need me to do, right? Rather than dismiss, well, you don't need to eat those, whatever. But in the same way, so I think people get a little. I guess I'm going to use the word selfish about that sometimes, where it's kind of like, why should I have to make these accommodations for you, right? It's your problem. It's not my problem. Rather than we're all in this world together. And yeah, it actually is, and I mean, I internalize something, and I don't want to be responsible for you to have that nut allergy reaction. I want to make sure I don't have any part of that. So I'm going to do what I can to make sure that I don't do that, or for you to get sick. I'm going to make sure that I'm wearing that mask or whatever, if I know that's what's going on.
Exactly. And I think, not to get too off topic, but some of that is rooted in American individualism.
Oh, yes.
And I've been seeing the past few years, especially this past year, a lot more posts on social media about how community building and finding community and things like that. And it's very encouraging to see that, like how your actions affect other people. And I hope that's something that really starts to build and grow, how to approach people in the world, whether it's, your immediate group, like your family, your friends, coworkers, but people in the world at large in an empathetic manner. Just kind of, it's a small mindset shift, but it can be a great one. How can I be thinking of other people? How can I put myself in their shoes? If I was in their shoes, what would they need from me?
Right.
And these seem like small things, but I think we've seen the past few years that that's not always everybody's thinking.
Definitely not everybody's thinking, but I think it comes along like if I've got a coworker who comes to work with crutches, they've got some kind of an injury. I'm going to ask them, how can I help you? Or I'm going to hold the door open. I'm just going to, what can I do? What can I do? Rather than become impatient because now it's taking you longer to get to this thing because you've got the crutches going on, and I'm inconvenienced by that. I think that's very much the American culture, and hopefully I'm with you. I think I'm seeing some changes, but I don't mean to be pessimistic. I'd like to think that it's going to get along those lines. It's like a person with even a very visual disability, for example, like a person in a wheelchair. Those. It's like what. Just I was on a bus not too very long ago where there was a gentleman, and he had a veteran's cap on, so he was obviously a war veteran, and he was in a wheelchair, and people were getting so frustrated that the ramp had to come down and let him on and I thought, you're not in a wheelchair. Can you just be you're not in the wheelchair, and that and be a little bit more patient that this person is, and what can we do, and stand back, or can I hold this for you, whatever it might be. I think is more of that community mind thinking. I would love to think that more people would get to, and maybe people listening to this podcast will get to and think, I should probably think about that. I should think about that. Not everybody's in the same spot. And again, I always use the term grateful. Be grateful that that's not you. It's not you aren't going through that. So be grateful of that, and then think about how can I assist that person or do something different in myself that would help that person out.
Right. And that's something I work on with my clients as well. In that empathy can actually help you get out of grief. Because if you notice, when we're in a really depressed state or when we're dealing with a lot of grief, we kind of implode in on ourselves, and we become, not purposely, but we become very kind of self-involved
Mhm.
because we're going through so much. Grief can be just a hell of a thing to deal with. And so when we get to that space, when we're out of the initial, say you've lost someone very important to you in your life, once we get out of that initial grief that's full of trauma where you're just in survival mode and hard to get past it, and into that stage where you're feeling kind of stuck but ready to move on with life, that's a really good place to start bringing in empathy and community building and kind of looking outside of yourself, which can help lift you out of that grief. That's not to say there's a cure for grief and that you're never going to grieve again.
Right.
I never promise that to people. It's about dealing with the grief in a healthy way. And then that's part of how you start getting unstuck, is to look outside of yourself and start helping people, start building community, start building that empathy muscle. And that all helps build the emotional resilience as well.
Yes. I'm going to go so far to say, and you may or may not agree with me, that I think for some people it takes something big in their life to wake them up, to see that expressing empathy, because I've never had a problem. I've never had this. I've never had that. So I don't understand it. But then some big thing comes in my life and knocks me down. And I went, oh, wow. Now I do learn how to be more, community minded and more empathetic to the people around me, because I had that experience in my life. So I think sometimes that comes into play where I'm thinking, you obviously have not had anything bad happen to you, and your
Yeah.
time is coming, because we're all going to go through something. So, to learn that, but not learn it in the hard way.
Right, right. And sometimes it does take learning things the hard way. And unfortunately for some people, and I've had to learn some things the hard way. I consider myself, I've always been a pretty caring, empathetic person, but certain life lessons I've had to learn the hard way.
Right.
And unfortunately, that's how life works. But those hard moments do kind of help you appreciate the better moments that much more
Yep.
too.
True. True. And I mean, I will go so far as to say I don't wish things didn't happen to me differently, because they did shape me into the person that I am, and I'm pretty happy with the person I am. I think helping other people is a very valuable thing to do, and I think, again, I don't know that I would know how to do that if I hadn't been through some pretty traumatic events myself, to really realize, wow, that's what that feels like. It's like trying to describe to somebody, what a panic attack feels like if you've never had one, or what childbirth feels like. It's like, if you've not been there, it's very difficult for me to explain it to you. I can't give you an example. Well, it's like this, because it really isn't like that, or whatever it might be. I think is helpful for people to just realize you don't know what someone else is going through, and to be aware of that, and respectful of that, and not just assume that this person's just being a pain because they want this or they need that, or whatever it might be. Whether it's, I had a coworker who needed a stand-up desk because of some physical issues, and I remember people, he spent all this money on it. I'm thinking, you have no idea why he needs the stand-up desk. Maybe he's got a back. We don't know, and it's not our business to know. It's just know that obviously he's got a reason for it. So step back, and again, be grateful that you don't have whatever issue it is that he's got.
Yeah. At my last job before I started coaching, I had some work from home days, whereas most everybody else had to go into the office. And so I'm sure there were people who were saying, well, you're getting this special treatment. But it wasn't special treatment, it was accommodation. And I think that's something that a lot of people with chronic illnesses, with any sort of health problem that causes them disabilities or fatigue or whatever it may be, certain limitations, struggle with. They need reasonable accommodation. And sometimes we internalize what these corporations are saying about, oh, well, that's special treatment, but it's not. It's reasonable accommodation.
Right. And in this country, we have the Americans with Disability Act. And if a person has a need for accommodations, that employer must legally accommodate that person to a reasonable measure. But so if I come in and I show my employer a note that my doctor says I need a stand-up desk or I need to work from home, the employer is obligated to do that. They can't tell my coworkers, well, this is what Christine's got going on, so that's why she has to work from home. And I don't want them to. But for those coworkers to realize there's a medical reason behind this and to respect that and not gossip behind my back and say, oh, you believe Christine's working from home and blah, blah, blah. Clearly there was a medical reason. And with any employer I know of, they're going to want a healthcare professional's documentation that you need this, and then we will comply. It's like with my students, like the same thing with students, where I have students where I'll get an accommodation letter from our disability department telling me this student needs extra time on a quiz. I don't need to know why, but now I know I'm giving you those accommodations. And not only am I legally obligated to, but I'm going to do it for humanity reasons as well. So it comes into play as that. To be respectful of the fact that someone obviously has a reason for this, and it's not for you to judge whether they should or shouldn't.
Exactly. And in the workplace, that can cause another level of grief, and that's where I didn't expect to be talking about assertiveness so much today, but it does go back to that assertiveness training and speaking up for yourself and setting healthy boundaries for yourself and not internalizing this sort of corporate ideal that any sort of accommodation you're getting is a special treatment, because it's not. And so that takes the guilt out of it, that takes the shame out of it. And, that's something we work on.
I do also think there is something to be said for employers maybe having more training of employees on this very topic, right? It's like when I took family medical leave for my cancer treatment, I had some coworkers who were not happy that I was going to be away from work, and they had to absorb my workload and respond in a very negative way. And I remember thinking to myself, why is my employer not schooling these people on not just be thankful it's not you, but this is the law and this is what we need to do. And this is how we should respond to a coworker who needs to have some time off for whatever reason it is, rather than be selfish and say, oh, I had to pick up this workload because she's on medical leave. And sorry, I couldn't conveniently make it so that I get sick at a time that's convenient for you, but that's what happens. And, we all need to follow those rules. So I think training of employees really sticks in my head since my experience, for sure.
I agree. Maybe that's something I'll pursue in the future.
There you go.
Like an extension of my coaching, employee training and empathy.
I honestly, I don't think there could be enough of it, really. In my case, I was working in an educational facility with coworkers who work with other healthcare students, and thinking, how could you not have this as part of you, right? And so on. So yeah, it's one of those I've become quite the advocate for, but I don't have time for it. So if you can do it, I think it's great. You'd be great at it. It's like, and what a fantastic service for people to know.
I love the idea, so I might look into that.
There you go. Well, Olivia, is there anything else you'd like to share today before we end?
I've really appreciated the conversation and you bringing me on a second time to talk about grief coaching and having autoimmune disease, having health issues. So thank you so much for that. If any of your listeners are interested in reaching out to me, they can do that on my website. And I'm also happy to schedule a free 1 hour session if they just want to talk and see if I can help them.
Link in the podcast notes for anybody who's listening or watching that wants to do that. We'll put that to make it easy to find you.
Thank you.
All right. Thank you. Have a great rest of your day.
Thank you. You too.
Thank you for joining us for this episode of Good Grief. We hope that the stories shared today have inspired and empowered you on your own journey of resilience. If you want to dive deeper into the themes of trauma, tragedy, and survival, be sure to check out my memoir, The Day I Became the Spider Killer, a memoir of trauma, tragedy, and survival. In this book, I shared my own raw and honest experiences, offering insights and strategies for overcoming life's toughest challenges. You can purchase the book on Amazon, Barnes & Noble, or listen to it on Audible. Your support helps us continue to bring these powerful stories to light and spread a message of hope and resilience. Stay tuned for more incredible stories on our next episode. Until then, remember, even in the face of life's toughest trials, there can be light, growth, and good grief.